Hello and good evening. We want to start with a little bit about ourselves. We are undergraduate students from the University of Nevada, Las Vegas, studying healthcare administration and policy. We are currently taking a Management of Health Service Organizations course, and as part of that course, we have been given the task of creating a website that will help Las Vegas consumers find the very best health services. Our goal is to research the benefits of telemedicine, explain what it is, why it is useful, and who it most benefits. We will also find health service organizations that provide this type of service in the Las Vegas area and compile information about these organizations in order to make it easier for our consumers to get the information they need. A little bit about telemedicine. Telemedicine uses two-way telecommunications equipment similar to that of Skype or FaceTime in order to provide real-time, interactive communication between a patient and a physician who's located at a distant site. Telemedicine is very useful because it can help patients who live in rural areas by making it easier to see a physician. Rather than having to drive to a neighboring town to visit a doctor, they can communicate with a physician from the comfort of their own homes, and they can do so relatively easily. Because this can be done digitally, it creates a much more convenient way for providers and consumers to consult with one another and can greatly increase access to care for many groups.
Telemedicine. Although telemedicine does incorporate the newest technology on the market, it has been around for multiple decades. The oldest form of telemedicine is referred to as teleradiology. Teleradiology is creating and transmitting medical images such as X-rays or computed tomography scans electronically in the form of digital signals from one location to the other. The Food and Drug Association, also known as the FDA, has overseen teleradiology since 1977. The FDA ensures that all care provided to patients in the United States is safe and that the medical devices are effective enough for the telemedicine process. This would include all of the devices and hardware as well as software products that would be used for diagnostic purposes. Overall, telemedicine is not something completely new in the healthcare industry. However, with all the new technological advances that have surfaced throughout the past years, it has flourished and has opened new doors that before would have never been believed possible.
Main locations where telemedicine has impacted completely is Southwest Medical. Southwest Medical installed a kiosk in a private room that allows patients to converse with a medical professional privately. The doctor reviews the patient's medical history before he attends the patients, and once the patient and doctor are live, the kiosk has self-administered tools to check blood pressure, oxygen levels, ear and eye exams. It gives patients another choice since the wait times can be extremely long. Southwest Medical has since then served over 15,000 patients through the Now Clinic platform, and it can be accessed on a smartphone or laptop, and it has helped improve the wait times immensely.
LifeBridge Mental Health offers telemedicine services for patients when non-urgent treatments are needed. The treatments are still confidential, so patients won't have to worry about that. In addition, it will help patients who have limited time in their schedules. Once patients are established with this organization, they can use this service. Here is a link to the website down below. The National Quality Forum is coming out with a metric to measure the effectiveness of telemedicine. It will be divided up into 4 basic categories. These are access to care, financial impact to patients and health providers, patient and clinician experience, and the effectiveness of the clinical and operating systems. Then there are 9 subcategories. They are expanded practice access, population management, care coordination, beneficiary engagement, patient safety and practice assessment, participation in an alternative payment model, which includes a medical home model, achieving health equity, emergency response and preparedness, and integrity behavioral and mental health.
Important links. Healthcare facilities in Nevada that are part of the telehealth network. This network helped link up patients in rural areas with practitioners all over the state of Nevada. This allowed the patients to have access to healthcare in the comfortable of their own home without traveling long distance. There are a total of 31 medical facilities in Nevada that are part of this network. Family Medicine Center, Mojave Adult Clinic, and Patient Care Center. They're all located in Las Vegas, Nevada. Ensuring coverage for telemedicine in the state of Nevada. Nevada state law requires Nevada Checkup and Nevada Medicaid to cover telemedicine as part of their program. In this measure, coverage will cover the same extent as seeing a healthcare practitioner in person. Medicaid requires patients to establish a relationship with practitioner prior to having a telemedicine service. This service must be obtained and approved to see if it is necessary for the patients. These insurance will not cover telemedicine because patients are located in remote area. Area of potential issues in telemedicine. Administrative value. Telemedicine is an expensive field to break into. Many executive personnel does not see the benefit of investing millions of dollars into something that does not guarantee revenues, since not every patient and every insurance company are willing to pay the extra money for this type of service. Reimbursement. Telemedicine is still a fairly new concept that is constantly evolving. Insurance companies, Medicare and Medicaid, are still developing guidelines for the reimbursement of this service. With an unclear guidelines, it is possible that service providers might not get the reimbursement they need for the certain telemedicine service. For example, Medicare's current guideline regarding telemedicine is that the program reimburses only a certain type of service delivered via telehealth when the patient is located in an officially designated rural physician shortage area. Sustainability. Even after incorporating telemedicine into their facility, sustaining the system throughout the year is also a potential issue they have to overcome. There is no doubt that technology is constantly evolving, which means that telemedicine will grow alongside with it. There will be new updates and new programs with each breakthrough that require the facility to invest millions of dollars into buying the new system. On top of paying for the upgrade, facility also have to pay for the licensing for using the system each year.
Our goal is to provide the public with more information on telemedicine and where they can access telemedicine services. This can include different websites and have more information on the subject, as well as where they can receive those type of services that still ensures they will receive the best quality with the best safety as possible. Another great place to find more information about telemedicine would be the American Telemedicine Association and their website. Their website provides information about what telemedicine is, as well as any information on education, events, and accreditation. The benefits of telehealth would include increased patient access, enhanced reach of healthcare services, reduced cost structure, 24/7 coverage, higher customer satisfaction, and reduced cost structure. There are also multiple places in Las Vegas where telemedicine is used, such as the Southwest Medical Kiosk and LifeBridge Medical Health, as discussed earlier. They both offer different types of services, however, they have both improved by providing technological advanced services. Patient satisfaction is also extremely important for all types of healthcare, and telemedicine is not an exception. Patient satisfaction has been pretty high for the past few days in regards to telemedicine. A study done in the Telemedicine Center of East Carolina University School of Medicine in Greenville showed that overall satisfaction was 98.3%. This study's results is consistent with previous studies conducted on telemedicine and patient satisfaction.
The advantages and disadvantages. Potential advantages that come with telemedicine include improved access to healthcare information and services, improvement within healthcare that would have otherwise not been accessible to a patient, an increase in healthcare delivery, increased quality control of screening programs, and ultimately a reduction in healthcare cost. On the other hand, potential disadvantages that could arise include less emphasis within the relationship between healthcare professional and patient, issues concerning the quality of health information and its delivery, and organizational and bureaucratic difficulties.
Quality and safety are also very important key factors for any type of service provided to the public. Telemedicine is still fairly new, and it has slowly increased in popularity, and there are so many things in place to ensure that telemedicine remains safe for the public, such as the National Quality Forum, which is a nonprofit organization that advocates good healthcare quality for all patients in the United States, and it is created by 4 basic areas of focus for telemedicine, such as financial impact to patients and healthcare providers, effectiveness to clinical and operation systems, access to care as well as effectiveness to both systems, as well as addressing key factors such as ensuring that the quality measures be widely adopted, consistency, as well as being accepted into federal funded programs. The National Quality Forum is not the only program that ensures the quality of telemedicine is up to par, however, is the most consistent.
Telemedicine will improve accessibility for patients in many ways. For instance, this will allow patients to be in the comfort of their own home. In addition, it is convenient and has shorter waiting times. There are cases when the copays are cheaper as well. Accessibility will be increased because it is able to be sent to rural, small, and remote areas that are struggling. There is going to be cost when using telemedicine software or hardware and updating it over time, but it should be seen as an investment. Even though technology can increase costs for healthcare organizations, telemedicine can help reduce operating costs. For instance, overhead costs will be reduced due to the number of physical visits, and there will be less cost due to less unnecessary hospital visits. Furthermore, the cost is more affordable to the patient most of the time.
Our team consists of Erica, Melissa, Margarita, Nee, and Benjamin. We are all seniors majoring in healthcare administration and policy. We all have various backgrounds and experiences related to healthcare, education, volunteering, and leadership. We each have our work assignments that relate to research, educating others about telemedicine, and networking. Erica's assignment is to review the quality measures of telemedicine and find more healthcare organizations that utilize the service in the Las Vegas area. She plans on adding information regarding telemedicine on the website that will give locals easy access to the information. Furthermore, she plans on sharing the knowledge of telemedicine to help lower costs and increase accessibility to care in the local valley. Melissa, her assignment is to research the cost involved when beginning to use telemedicine in healthcare organizations. She plans on providing information about the reasons why it is worth the investment and how it will positively affect both patients and the healthcare providers. She will show medical professionals the incentives in order to express how the savings outweigh the cost. Margarita's assignment is to actively research and update the advantages of telemedicine on a broader scope so that the community can work together to improve and further promote social and individual health benefits. In the future, she plans to work alongside local entrepreneurs to help promote health mobile applications to further increase health accessibility to all. Need's assignment is to connect and network with local health organizations to gain support with the telemedicine initiative. She plans to acquire all the necessary support to avidly improve telemedicine knowledge, implementation, and progression. Benjamin's assignment is to research the ratings of medical staff and health service organizations that use telemedicine and store the information for easy access by other team members. Constantly updating the ratings of providers will assist our users in making the best decisions for their health. It will also provide other team members data which can help make crucial decisions.